Hi, Veterinary Unicorns. Today I want to talk to you about the 5 things that you just need to give away for free at your veterinary hospital. Have I lost my damn mind? I might. But here's the thing, I'm super passionate about this, and I have lectured about this, and I will continue to lecture about this, and now I'm doing a vlog about it. So when you have a patient that comes into your hospital that is experiencing a life-threatening emergency, and your client is financially constrained, we need to be able to move forward for the best care of that veterinary patient. And I get it, the client doesn't have money. But too many hospitals I have personally worked in, unfortunately, money is the first thing. And they don't move forward with actually trying to treat that veterinary patient until we can come up with a way that the client's going to be able to afford to do so. No. We all went into this business to take care of animals. And here are 5 things that your hospital has to do. Not needs to do, has to do. Not it would be nice. No, just do it. I don't want to hear about it anymore. Because these things are not expensive. Can we start dealing with the patient first and worry about the money second? A lot of times, and I'm going to talk about this in a podcast later on this year, these clients experience a trauma. They just watch their dog get hit by a car. They just watch their cat have a seizure. They're not of sound mind nor body to figure out where they're going to come up with a couple $1,000s that you're now demanding from them. So let's focus on the patient first. And here's the 5 things that every veterinary hospital should just give away. Give it away for free for clients who don't have the money, and worry about treating the pet and the money second. All right, the first thing, IV catheter. They're cheap. Put one in. I mean, if the patient's having an emergency, you know whether or not that patient is going to need to be treated or whether or not it's going to need to go to the Rainbow Bridge. Either one of those things needs an IV catheter. So just get an IV catheter on that patient. Most emergencies require my number 2, bag of fluids, usually isotonic crystalloids. So lactator ringers, Norm R, P-Lite, sodium chloride, crack a bag of fluids, start volume resuscitating this emergency patient. Now, obviously, if we're dealing with a head trauma patient, a patient that has heart disease, a patient that has pleural effusion, fluids are not indicated for the most part. But most other emergencies, hit by car patients, DKA patients, dehydrated parvo puppies, all these things require bags of fluids. So can we please just start volume resuscitating our patient and talk about the money thing later? Time is of the essence. This is really important. The third thing, oxygen. If the patient's in respiratory distress, just slap some oxygen on this patient. It's cheap. It doesn't cost that much. And there's a variety of methods to deliver oxygen. That's not really what this quick vlog is about, but put oxygen on them. It's not that expensive to do so. And number 4, pain medication. We went into this business because largely veterinary professionals resonate and connect with animals much better than we do with human beings. I love pets. I've dedicated my life to helping them and moving this profession forward. And if we are withholding pain medication, what are you doing in this business if you're withholding pain medication from an animal because a client doesn't have money? Just stop that shit. Just stop it, because I've seen it and it's not okay. We need to be able to give away pain medication to patients that need it. And then the very last thing that every veterinary hospital can do is euthanasia. And it's hard when that's the decision that has to get made, or that's the decision that is in the best interest of that pet because they have something terminal going on. But we can always do that for free. It really doesn't cost that much. And it's the one thing that we in our veterinary profession can give away for free because we're kind individuals. And I find a lot of my veterinary colleagues, unfortunately, are in companies or hospitals or businesses where money is required to be paid upfront before there's any sort of progression of trying to treat that pet patient. And that's not okay. I get it. Pets don't come with health insurance like us human beings. Most of the time, when you go into the emergency room or into your doctor's office, they assume you have health insurance. And if not, they will bill you an exorbitant amount of money later. And then, of course, unfortunately, in human medicine, they take you to court if you don't have health insurance, and that's a whole nother story. In veterinary medicine, we don't want to actually have to take these people to court for those few things I listed. Just do it. Because most of the emergency patients that are going to come into your hospital are going to benefit from those things. And the other thing is it allows the person to digest what just happened to their pet, figure out maybe if there's a way that they can actually afford it, and move forward when they have a little bit better sense of themselves and the situation that's going on. We bombard them with, you need to pay now or I can't treat your pet. And it ends up all over social media, Facebook, and all those things. What I've told you to do, again, the catheter, the fluids, the oxygen, the pain meds, and the euthanasia, we can do at $0 for clients that have no money. And honestly, the fluids in the catheter, a lot of times, sometimes when we're dealing with hit by car patients, that's all they need. Isn't that amazing? Some pain medication and oxygen. That's it. So anyway, I want to challenge you, please. Those are the 5 things you should just give it away. It's going to make you feel better. It's going to make your clients feel better. And it's what's right for the pet patient. And I'm pretty passionate about it. Thank you so much for listening. And check out my website at vetteamtraining.com.